Good Sunday morning. I'm Jaden Jefferson, and welcome to this week's Community Focus. A University of Toledo study has found that even when we're using our insurance to pay for prescriptions, we may not be saving as much money as we think. I talked to Dr. Varun Vaidya, professor of pharmacy practice at the university, for more on this study. Take a look.
My background is I'm a pharmacist by training, and I have done PhD in pharmacoeconomics and outcomes research. So this is a field where we look into the economic side of pharmacy. So we look into the prescription drug prices, how they're cost effective, where can we save money, that type of research that I do. So about this study, we started doing a few years ago, and it's been making for over some years. And the objective for this study was to look into prescription drug pricing and see how much people are actually paying while they're using their prescription insurance. And also, if those who are not using prescription insurance, those who are using cash price, going through different channels like using GoodRx discount card programs or Amazon online pharmacy, and to kind of compare whether having insurance, what kind of advantage those give to the patient that are buying these prescription drugs.
And obviously, in the United States, we pay a lot of money for prescription drugs, and a lot of people, they are seeking out those opportunities to save money. So obviously, this information would be a bit disappointing. So were you guys able to find out what really saves money?
Sure. So Jaden, the one thing here is when we talk about prescription drugs and pricing of prescription drugs, it's a little complicated than most people think about, because when we think about prescription drugs, most people think it is as just one entity of prescription drugs. But when it comes to pricing of those prescription drugs, we have two broad categories. One category is just brand name drugs that are very expensive. Oftentimes we see the news of the drugs costing, $30,000, $40,000. These are the cutting edge innovative drugs that are new to the market, that are still patent protected by a big pharmaceutical company. And that's why those prices are really high. Now, then there's another category of drugs where, those drugs have expired that patent protection, so that the market exclusivity for that big pharmaceutical company no longer exists. So now those drugs are open for any pharmaceutical companies to manufacture. And many of them are simple, the chemical molecules that bulk manufacturing is not that difficult. So the price goes really down. The majority of the price is basically, it's the innovation, it's the intellectual property in that. Once that goes away, to manufacturing those drugs is not that expensive. So then we have this big category of drugs that fall into these generic drugs, where we have multiple pharmacies making those, and then there's a big competition, so the prices go really down. So most people, when they think about prescription drugs, they don't think about, is it a generic drug or is it a brand name drug? So that's when we say we pay a lot for our prescription drugs, most of the times we're talking about those expensive drugs. Now, when it comes to prescription drug insurance, then that accounts for both of these, whether you have a generic drug that you're filling at your local pharmacy or a very expensive brand name drug that you're filling at a pharmacy, you still go through that insurance claim. And because it's very technical, most people don't know the technical details, and they're not supposed to, it's not their field, right? So in that case, what happens is then people just that's why they have insurance. That's what the insurance is supposed to do, negotiate on behalf of them and give them the best prices possible on those drugs. But what happens in reality is sometimes, even for the generic drugs, when you use your insurance, you might find out that your copay, even after paying your deductible and your premium and all those things, that premium that the out-of-pocket payment that you pay at the pharmacy to get that medications sometimes could be higher than the cash price of that. You say, hey, I don't want to use the insurance. I want to buy the prescription drug for what's the cash price for that. It could be cheaper than that. So that's kind of what our research was about.
Was there anything in your research that maybe came as a shock, that you were thinking, going and expecting something different, but then you were completely blindsided?
So it wasn't really a shock. We were expecting these results because ours is not the only study, and this is definitely not the first study looking into this kind of an analysis. People have done from a different ways. So there was a study that was published a year ago that they looked into specifically for Medicare beneficiaries. And then they were at that time focusing on Mark Cuban's pharmacy, if you heard about Mark Cuban started his own pharmacy program, and that's helping a lot of patients to cut down on the costs. And they found very similar results. People were paying much less going through like just paying cash through those online pharmacies started by Mark Cuban. And versus, those were using insurance. So we kind of were expecting, we were a little surprised the scale of it like this. So we found like one in 5 prescriptions where actually cash price was lower than what people pay otherwise using their insurance. So that might be a little bit of a surprise factor, but we kind of went into the expectation, and that's what we found.
There are so many different drugs out there for so many different reasons. And I'm sure that in doing a lot of this research, there were definitely those moments that I think for the outside public were probably really surprising to see. So in terms of looking into the future, what do you hope to get out of this information?
So what we get out of this information is definitely create more awareness. We need people to know that, and then it's not their fault. Like if I'm a patient and I have prescription insurance, I'm not supposed to do comparison shopping and look for what medication is right for me. That's why I rely on those experts and my insurance. So ideally, it should not be as long as I pay my premium, I have insurance coverage, and if I unfortunately get into a situation where I need some kind of a drugs, that should be covered. But in reality, what's happening is, like I explained, sometimes you might lose money, using your insurance and going through this pharmacies and filling for those medications. So what we, based on this analysis and, the existing body of literature in this area, what we recommend until there are some reforms happen, until there's, this is sorted out, and then the system is working the way it should be, until that time, patients should, take few things in their hands. They should, first of all, ask your pharmacist. Pharmacists are there. They're not only very knowledgeable about the therapeutic area, they're at the cash register. They see that. They see what's the cash prices. They see what your insurance is charging and all that. So talk to your pharmacist. Many times you'll end up, saving money. They can recommend you generic drugs if they're available for those expensive brand name drugs. They can also look into, if the cash price is cheaper for you. Talk to your doctors. If the pharmacist recommends that hey, this is an expensive brand name drugs, and if you just cannot afford it, maybe there could be a generic option available. So talk to your doctor and get your prescription changed. That happens a lot too. So that definitely can save you money. And in addition to that, if you can do a little bit of homework on your own, so go through what, especially if you're on multiple medications and that are really causing you pain on your wallet, then, sit down, go through websites like GoodRx. These are very user-friendly. Just put the name of the medication into those kind of websites, and they show you, right there, like what different options are available. There could be different pharmacies offering different cash prices. There might be online coupons available, and those savings are significant. Many cases you can save hundreds of dollars every month, especially when it comes to chronic medications.
And that's surely some surprising information, but even really great advice as well, because you got to sometimes do your homework. That's important.
Yep.
Dr. Varun Vaidya with the University of Toledo, thank you so much for your time.
Hey, thank you, Jaden.
Thank you. And that's this week's Community Focus. Have a great week.